When it comes to knee arthritis, why is it that some people have pain while others don't? That's the question we're going to be answering in today's video. My name is Harlow and I'm the Over-Fifties Specialist Physio here at HT Physio in Farnham. And today we're going to be talking about knee arthritis and why some people really suffer with it and others get on just fine. Now, before we dive into the topic of today's video, please remember to like this video and subscribe to the channel. You can do so in the links below this video. Now, let's go on to knee arthritis. So first of all, knee arthritis is basically just a fancy term for the natural process of cartilage loss in the joint. And we have a couple of joints that make up the knee. We've got the joint between the kneecap and the femur, which is the thigh bone, and we've got the joint between the two main bones, the femur and the tibia. So when the knee moves, it moves like this, and you can see that the bones move close to each other, and between the bones you have a layer of cartilage which cushions it and helps to lubricate movement so that the bones don't rub. Now, as we get older, we can lose that cartilage, and it can often cause pain in the joint when we bend and when we walk and weight bear, and it can also cause stiffness, especially in the morning. But those symptoms don't actually happen for everyone who has knee arthritis. Now, there's a couple of strange stories that I've come across in my time working as an over-50s specialist. And some of these examples happen when someone has a problem with their leg and we send them for an x-ray. Let's say they've got a hip pain. So we send them for an x-ray of the whole leg and we see that their hip looks okay, but their knee has almost got no cartilage whatsoever. So it's quite literally bone on bone. And then we'll speak to this person after the x-ray and we'll say, do you have any problems with your knee or is it just the hip? And they go, no problems with the knee, never noticed anything whatsoever, still playing tennis, still playing golf, never noticed knee pain at all. And we look at these people and we think, how on earth does your x-ray look so bad, but you don't have any symptoms? And this is actually quite common. So this really started to throw the medical profession in the 80s and 90s when we started to use more and more imaging, because we would see things on a scan and we'd think, surely that's painful, but in reality, it wasn't. Now, the answer to the question, why does it hurt for some people and not others? Really, we don't know the truth. Not yet, anyway. We have some ideas. There are some clues that the pain that some people feel when they have arthritis could be down to the mechanics of the joint, which is one of the reasons that physiotherapy can be very effective at treating arthritis pain. If someone allows stiffness to develop, or they allow weakness in the surrounding muscles to develop, or they get tightness in the surrounding muscles, this can cause pressure on the joint, and my theory is that it can make pre-existing arthritis painful. And this is the way that I can explain the fact that many of my patients report less pain or complete resolution of their symptoms, even though the arthritis itself doesn't change, just because we fix those mechanical problems. So there are a couple of common causes, specific causes of pain for people who have arthritis that I've found. One of them is weakness in the thigh muscles, so the quadricep muscles at the front of the thigh, because these control the alignment of your kneecap, and they also control your ability to keep your legs straight. So if they're weak, that can aggravate arthritis. Another one is tight calves. So if you have calf tightness in the lower part of your leg, because your calves actually attach at the back of the knee above the joint, if they're tight, they pull everything together and can compress the knee joint. So tight calves can be another cause of pain. Another cause of pain in arthritis that I've found is weakness in the hips. So if you have weakness, especially in your gluteal muscles at the top side of your hips around the back, then that can cause a problem with the alignment of the entire thigh bone, which can lead to stress, particularly on the inside of the knee. So all of those problems often combine. So when I see people in clinic, they often have all of those problems. And if we fix those problems, typically the pain starts to reduce as well. So the key takeaway, really, if you are suffering from pain from knee arthritis, is to first of all realize that you're not alone. Secondly, you should realise that your situation is not hopeless and you certainly don't always need a total knee replacement. And thirdly, it's important to get an assessment from a qualified professional who's seen this kind of thing before and has worked with people's lower limb mechanics, which can significantly reduce the stress on the knee and can help you to feel better, even though we can't regenerate the cartilage. Of course, some people have knee arthritis that's so bad that no matter what we do in physiotherapy, it just won't get better. And those people are candidates for surgery. But if you haven't had a good, experienced physio do some hands-on therapy with you and put together a targeted exercise program, you don't yet know if your problem is just mechanical and can be fixed or whether it's down to deterioration of the joint. So get checked out. We are here to help. If you're in Farnham, you can come and visit us at HT Physio and we'll have a look at your knee. But if you're not nearby, you can always pick up a copy of my book. It's called Thriving Beyond 50 and it will give you loads of tips and strategies to get your knee sorted and other joints in your body too. Anyway, I hope this video has been helpful. Please do leave me a comment below and let me know how you found it. And I look forward to speaking to you on the next episode.